Western Australia continues on its path out of the pandemic on Tuesday, with a number of major rule changes coming into effect just days after the state started to ease its borders. Announcing the new rules on Monday, Premier McGowan warned the road ahead was about to get very bumpy. He said the new close contact and isolation rules were necessary in a higher caseload environment as Omicron continued to spread through the community. The state is going to embark on a difficult period, he said. Western Australians should take higher case loads seriously, but it's not a cause for panic. WA Premier McGowan speaking at a government COVID-19 press conference. January 28, 2022, ABC News, James Carmody. So what is changing? When should you take a RAT? And what if it's all left you feeling a bit uneasy about what's ahead? What are the new rules if I test positive? From today, anyone who tests positive for COVID will have to isolate for a minimum of 7 days, down from 14 days. At the 7-day mark, if you still have symptoms, you'll have to continue isolating until the symptoms clear. If you don't have any symptoms though, you'll be allowed to leave isolation without further testing. What about close and casual contacts? The definition of a close contact will be changed from today, restricting it to people who are a household or intimate contact of a COVID-positive person they had contact with during their infectious period. Are a household or intimate contact of a COVID-positive person they had contact with during their infectious period has had a close personal interaction with a COVID-positive person while masks were removed, including more than 15 minutes face-to-face, or 2 hours in a small room. Has had a close personal interaction with a COVID-positive person while masks were removed, including more than 15 minutes face-to-face, or 2 hours in a small room is notified by WA Health in specific circumstances. Close contacts will have to self-isolate for 7 days from their last contact with a positive case, regardless of whether they have symptoms. Rapid self-tests will play an important role in WA's path out of the pandemic. AAP, Lucas Koch. A symptomatic close contact will have to take a PCR or rapid antigen test on day 1, and if they are negative, another RAT in 24 hours. If that test is also negative, and no other household members have tested positive, they'll need another RAT on day 7 before ending isolation. An asymptomatic close contact will only have to take a PCR or RAT if they develop symptoms, and on day 7 before ending isolation. Casual contacts will no longer have to get tested, but people are still encouraged to check exposure sites and get tested if they have symptoms. What happens if I return a positive RAT? It's now a legal requirement that all positive RATs are registered with the government, either online or by calling 13 COVID. You'll need to enter the date and time of the test, your personal details, and a contact phone number. WA Health will then contact you with information about isolation and check whether you need extra medical support. That will be delivered as part of the WA COVID Care at Home program, which will involve calls to check on people's welfare. People might also be provided with a pulse oximeter to measure their blood oxygen levels and heart rate. An oximeter enables people to monitor their blood oxygen levels at home. Tima Miroshnichenko, Pexels. The government has warned that anyone who doesn't report their positive RAT result could face up to 12 months in prison or a $50,000 fine. What changes for travelers? From Wednesday, the isolation period for international and interstate travelers will drop to 7 days, but they must wear a mask indoors and outdoors for the next 7 days. Quarantine rules will be relaxed for interstate and international arrivals who are vaccinated. AAP, Dan Peled. Some vaccinated direct international travelers will be allowed to quarantine at home, with more set to be welcomed when the arrivals cap doubles to 530 per week. Unvaccinated international travelers will still have to spend 14 days in hotel quarantine. Travelers will also be given the option to use RATs on day 1 and 7 of their quarantine periods, with household members also required to return a negative RAT on day 7. These rules also apply to people who have arrived since Saturday, and are currently in quarantine. What about schools and childcare centers? A specific definition for a close contact will be introduced in schools and childcare centers from today. They are similar to the ones that will apply to the wider community, to include people who had face-to-face contact with an infectious person for more than 15 minutes, where either person wasn't wearing a mask. Had face-to-face contact with an infectious person for more than 15 minutes, where either person wasn't wearing a mask, spent more than 2 hours in a small indoor space, or a classroom, where masks were removed. Spent more than 2 hours in a small indoor space, or a classroom, where masks were removed, have been told by WA Health that they are a close contact. The rules are aimed at reducing the risk of transmission while keeping children in school. ABC News, Robert Konigluck. The government has also announced a string of other measures to limit the spread of COVID in schools, including a ban on face-to-face events. A ban on face-to-face events, school camps being cancelled or postponed. School camps being cancelled or postponed, dividing students into fixed groups to reduce the chance of COVID transmission. Dividing students into fixed groups to reduce the chance of COVID transmission, modifying timetables, break times and pick-up or drop-off times where practicable. Parents will still be allowed into schools for drop-off and pick-up, but in outdoor areas only, with all parents wearing masks. Parent-teacher interviews will be held online or over the phone. It's been recommended that childcare centers use outdoor drop-off and pick-up where they can. An additional layer of rules, announced last month, will only kick in when WA reaches an as yet undefined very high caseload. Should I still get a PCR test? The government is still encouraging people to use PCR testing clinics as a priority, while clinics can manage the number of PCR tests required. But in a media release yesterday, the government recommended rats be used in certain scenarios, including before attending a large gathering in a crowded place, like a wedding or funeral. Attending a large gathering in a crowded place, like a wedding or funeral, visiting a person who is vulnerable to the risks of COVID-19. Visiting a person who is vulnerable to the risks of COVID-19, visiting a high-risk setting, like an aged care facility or hospital. They've also been recommended when people need to quickly check for COVID-19, or when they are recommended to do so by WA Health. Why are we doing this? Mr. McGowan said yesterday the new protocols aren't a sign the pandemic is over. They signify the start of the real impact of Omicron in Western Australia and will help manage community transmission and minimize disruption caused by the virus in the community and economy, he said. Mark McGowan says the changes will help keep businesses open. ABC News, James Carmody. Comparing WA's experience to that of New South Wales, he said the new rules will help balance protection against COVID-19 while allowing businesses to continue operating. Keep up your activities, keep going to work, support your local business, but be sensible and safe, he said. What if I feel worried? The Premier acknowledged yesterday that people might feel a little uneasy about the transition. Opening ourselves up to more risk does mean the virus will spread faster, he said. Given our low case numbers for so long, it may shock some people, but it's necessary to keep the community moving. Edith Cohen University psychology lecturer Shane Rogers said people should take heart from how the eastern states have faced Omicron. We've been one of the most fortunate places in the entire world, from what I can gather, and this situation is no different, he said. We've got our brothers and sisters and cousins over in the eastern states who've gone through this in advance of us. There are large cases, it's not enjoyable by any means, but at the same time they've gotten through it, so we can too. Space to play or pause, M to mute, left and right arrows to seek, up and down arrows for volume. Watch duration, 2 minutes 3 seconds 2 minutes and 3 seconds. Data shows many older Australians haven't had their booster.